So I don't really like making too much of these videos because the reason is because I don't want to scare people. Because, like, again, constipation. That's a word I don't use a lot in a lot of my videos, guys. I don't usually use the word constipation that much. Because you gotta realize that constipation is a thing that everybody experiences at least once in almost a couple months. At least once per day, someone has and has been diagnosed with constipation. It is the most common thing I think anybody can ever experience, and even though it is so common, it is so freaking annoying. Because it's like when you need to get that bowel movement running, you just can't. You know, and it can get bad. And then when I sit here and I think, that about, like this can't be dangerous, you start to travel down a road you just don't want to go down because it makes you worry. But it's a good thing I came up here with this video because a lot of times constipation isn't fatal at all, but that's not always the case. And that's an unfortunate event that people take is like, people don't realize there are fatal complications, and yes, most of the complications on here are extremely fatal and can kill you quickly. But that don't mean to go ahead and say it can't be treated by a suppository or an enema before you end up dying, or a soap sud enema. That doesn't mean anything like that. It's just really sad that we have to look at it like, yeah, it's very fatal. And yeah, it may not be as fatal right off the bat, but it takes a couple months to maybe weeks, maybe even that, yeah, for it to be fatal, because you gotta go a couple weeks and months without pooping. Months, yeah, you're dead. Weeks is where it gets pretty bad, because if you don't poop, it builds up, and your colon can only expand so much. So we're gonna be going over everything you need to know, guys. Here we go. What is it? So constipation is a bowel dysfunction that makes it difficult or infrequent to have a bowel movement. Now, that doesn't mean you don't go. There is one complication on here that makes you not be able to even make a fart. Okay, and if you can't fart, then you got fecal impaction, which we'll get to what that is later. But, I'm saying in general, constipation is a bowel dysfunction, alright? It's not word, it's a dysfunction, which means it's not functioning right. That makes it difficult. Underline the word difficult. Doesn't say you can't go. It means you go but can't, you go, you can't. So if you want a normal bowel movement, you want it where you can go, you can go each time you need to go. Instead of going and then not going and then going, and that's basically infrequent. That means you're going and then not. So yeah, you gotta be careful with that, because if it is constipation, you gotta get some treatment for it. Now, it's not always fatal. It will mainly go away within a couple days. Some cases are different, though. It really depends on you and your luck. So yeah, that makes it difficult, like I said. So what causes it? So it's caused by a change in a diet or routine. A brief illness, it can be a virus, it can be an infection. It could be your hair standing on top of your head. Medications such as antibiotics, pain relievers, antidepressants, antacids, iron pills, allergy medicines, anti-seizure medicines, anti-nausea medicines, and blood pressure medicines. Those are all medications that can cause it, which is mainly every single one under the book. Not eating enough fiber, that's another one. If you're not eating enough fiber kind of loosens up your stool, which makes you be able to go more. And if you're not getting enough of that, then your poop will be dry and can end up drying up in your body. Not drinking enough liquids, so liquids have to go through your bowel too, which can soften up your bowels. I drink at least 2 liters and I still have constipation. We all do. It's not something to be afraid of or to be embarrassed about, because it's an everyday thing for many people. Everybody doesn't mean it doesn't have to be the same person, but we at least know that everybody in the world has at least gone through what this is. So not getting enough physical activity, so not walking or running when you have the capability of doing so, can also cause something like this. Certain health and nutrition problems such as celiac disease, diabetes, or disorders that affect the brain and spine. How to treat it. So to relieve constipation, you can drink more water, avoid caffeine and alcohol, eat more fiber-rich foods such as fruits, vegetables, whole grains, beans, prunes, or bran cereal. Eliminating low-fiber foods such as milk, cheese, and processed foods. Getting at least 150 minutes of moderate exercise per week, using the bathroom when you feel the urge. Raising your knees with a footstool when having a bowel movement. When to see the hospital. Now, this is where it gets pretty dang cool. Pretty darn interesting, okay? To see a doctor is when your constipation doesn't go away with self-care, which means it is something that needs to be treated by your medical professional. You have long-term constipation. Long-term does not mean 2 to 3 days. It means at least a week worth of not going to the bathroom when that starts to become an issue. Because if you don't use the bathroom in a week, well, I hate to tell you, you might have something really wrong with your bowels. You have bleeding from your rectum, blood in your stool, or continual pain in your abdomen. So yeah, that is another one, guys. So you want to make sure to look out for those. Symptoms of constipation: having fewer than 3 bowel movements per week, hard, dry, or lumpy stools, straining during bowel movements, painful bowel movements, feeling like the bowel hasn't fully emptied, bloating, abdominal cramps, feeling like the rectum is blocked, needing to use a finger to pass stool. A finger. Complications, here we go. Complications of chronic constipation and can include hemorrhoids. Straining to have a bowel movement can damage the blood vessels in the rectum, causing swollen red veins. Anal fissures or hard stool can reach the sphincter muscle, causing tears in the skin around the anus. Fecal impaction. This is where we get the dangerous ones. Fecal impaction or hard stool can pack the rectum and lower bowel so tightly that the colon can't push it out. Rectal prolapse. Straining can push a small amount of the intestinal lining out the anus. Stercoral ulcer is an impacted stool can erode the lining of the lower bowel, causing bleeding or bowel perforation, which means your bowel ruptures, all that poop and stomach contents leak into your stomach, causing a widespread sepsis infection. Fecal incontinence, which is an overfull bowel, can cause involuntary diarrhea. It means involuntary means you can't control it, while voluntary means you can. So, urinary incontinence straining can weaken the pelvic floor muscles, making it more likely to involuntarily pass urine. Constipation rarely causes complications in most people, but it can be serious and should not be left untreated. What are these complications? Hemorrhoids are swollen veins in the anus and lower rectum, not dangerous most of the time. And as if thin in the moist of the lines the anus is a muscular opening at the end of the digestive tract where stool exits the body. Commonly cause of an anal fissure include constipation, straining or passing hard or large stools during a bowel movement. Anal fissures typically cause pain and bleeding with bowel movements. You may also experience spasms in the ring of muscle around the end of your anus, called the anal sphincter, not usually dangerous. Fecal impaction or hard stool can pack the rectum. Okay, we just read all this. Okay, here we go. So what is rectal prolapse? Rectal prolapse happens when part of the large intestine's lowest section, the rectum, slips out the muscular opening at the end of the digestive tract known as the anus. While rectal prolapse may cause pain, it's rarely a medical emergency. So, rectal prolapse is sometimes treated with stool softeners, suppositories, and other medicine, but surgery is usually needed to treat rectal prolapse. So, surgery is needed to get this repaired and fixed, because again, it's not in your body, and if you were to do it yourself, you can lead to strangulation of your bowel, cutting blood circulation off, causing you to go into gangrene and shock from how much of the stuff you lose. You do need, some people say you don't need it. It's actually true, you don't need your rectum, but it would be a heck of a life living without a rectum to be able to poop. Anyhow, symptoms of it. If you have a rectal prolapse, you may notice a reddish lump that comes out of the anus. Often while straining during a bowel movement, the lump may slip back in the anus or may continue to be seen. Other symptoms may include you cannot control your bowel movements, known as fecal incontinence, constipation or loose stools, leaking blood or mucus from the rectum, feeling that your rectum isn't empty after a full bowel movement. Causes of it. Some things may increase your risk of getting a rectal prolapse, including sex. Most people with rectal prolapse are women. Age: rectal prolapse most often happens in people over 50. Constipation, straining may increase the risk of rectal prolapse. Treatment. Treatment for rectal prolapse often involves surgery. Treatment for constipation with stool softeners, suppositories, and other medicines are often needed. There are different surgical methods for treating rectal prolapse. Your healthcare provider will pick the best treatment for you after going over your age, health problems, and how your bowels work. So complications include incontinence, loss of bowel control can occur leading to fecal incontinence, strangulation. The prolapsed tissue can become trapped, cutting off blood supply and causing tissue death. Ulceration. Prolapsed tissue may develop ulcers leading to pain and bleeding. Infection. Prolapsed areas are at risk for infections due to exposure and moisture. Psychological impact. Men may experience anxiety, depression, or embarrassment related to the condition. Surgical risks. Surgical intervention carries risks such as infection, bleeding, and complications from anesthesia. Reoccurrence. There is a possibility of the prolapse returning after treatment. Nutritional issues. Difficulty with bowel movements can lead to dietary changes and nutritional deficiencies. Impact on daily activities. The condition can limit physical activities and affect quality of life. What is this strangulation they're talking about? Strangulation bowel, also known as strangulated bowel obstruction, is a blockage in the intestines that cut off blood supply to the affected area. It's a surgical emergency that can lead to serious infection, shock, and death if left untreated. Strangulated bowel can occur when part of the intestine becomes trapped in an abnormal opening, such as a hernia, or in a condition called volvulus or interoception. I can't even pronounce that. It's a progressive disease that can develop into gangrene as little as 6 hours. Symptoms of a bowel obstruction include severe abdominal pain or cramping, vomiting, feeling full or swollen in the abdomen, loud sounds from the abdomen, feeling gassy but being unable to pass gas, and constipation. Complications are peritonitis, a life-threatening abdominal infection that can occur when the intestine tears and digestive juices leak out. Sepsis, a life-threatening system-wide infection that can occur when the intestine tears and digestive juices leak out. Gangrene, tissue death that can occur when the intestine does not receive enough blood. Shock can occur when the abdominal wall dies, the intestinal wall dies and ruptures. Multi-organ failure, also known as MOF, can occur if strangulation is not diagnosed early. Alright, so yeah, multi-organ failure can occur if strangulation is not diagnosed early. So what is stercoral ulcer? A stercoral ulcer is a sore that develops in the colon due to severe prolonged constipation. It's a rare complication of constipation that occurs when stool impaction puts pressure on the bowel wall. Symptoms are stercoral ulcers or rare wounds in the colon wall that can cause a number of symptoms, including sudden severe lower gastrointestinal bleeding, intense abdominal pain, rectal bleeding, mucus in the stool, pain during bowel movements, chronic constipation, abdominal distension, which means your stomach is distended a little bit, abdominal cramping, nausea, and vomiting. Complications are perforation, a serious complication that can lead to a high risk of mortality. A perforated ulcer is a hole in the digestive tract that allows food and digestive juices to leak out. This requires urgent medical attention. Hemorrhage, bleeding from stercoral ulcers can be treated with endoscopic hemostasis. Mortality. A stercoral ulceration can have a mortality rate of more than 50%. Fecal impaction, also known as a constipation plug, is a large, hard, and dry mass of stool that gets trapped in the rectum. It's a common result of chronic constipation and can cause severe pain and discomfort. Symptoms are constipation. Long-term constipation is a common cause of fecal impaction. Stool issues, small semi-formed stools, straining during bowel movements, or leakage of liquid or watery diarrhea. Abdominal discomfort, abdominal cramping and bloating, rectal bleeding, bleeding around the anus or rectal bleeding. Other symptoms is pain in the abdomen or back, nausea, vomiting, problems urinating, or bladder pressure or loss of bladder control. Complications from fecal impaction can be serious and even life-threatening, including bowel perforation, a hole in the colon, hemorrhage, bleeding, fecal incontinence, uncontrollable bowel movements, ulcers, sores, or urinary tract obstruction, increased urinary frequency, urinary overflow incontinence, or hydronephrosis. Sterocolitis, colitis, pressure, necrosis from the fecal mass can cause ulceration and perforation of the bowel wall. Dangerous complications of this that we're still going to go over now is sepsis, peritonitis, gangrene, multi-organ failure, and abdominal abscesses. Sepsis is a life-threatening condition that occurs when the body's immune system has an extreme response to an infection or injury. This response can damage the body's own tissue and organs, leading to organ dysfunction, shock, and sometimes death. Sepsis is a life-threatening emergency that requires immediate medical attention. Symptoms include fever. A high fever is a common symptom but can also occur with other conditions. Breathing, shortness of breath, rapid breathing, or pain when breathing in or coughing. Heart rate, a high heart rate or weak pulse. Blood pressure, low blood pressure, or lightheadedness. Mental status would be confusion, disorientation, delirium, or agitation. Skin will be clammy or sweaty, rash, or mottled skin. Other symptoms: source of infection, decreased urine output, nausea, vomiting, sensitivity to light, or loss of interest in food. Complications of this will include a lot. Organ damage. Sepsis can cause temporary or permanent damage to organs such as the brain, heart, and kidneys. Kidney failure. Sepsis can cause kidney failure. Tissue death. Sepsis can cause tissue death, also known as gangrene, in the fingers or toes, which may require amputation. Lung damage. Sepsis can cause permanent lung damage from acute respiratory distress syndrome. Brain damage. Sepsis can cause permanent brain damage, which can lead to memory problems or more severe symptoms. Heart damage. Sepsis can damage the heart valves, which can lead to heart failure. Immune system problems. Sepsis can cause later problems with the immune system, which can increase the risk of future infections. Post-sepsis syndrome, PSS. PSS can affect up to 50% of sepsis survivors. Symptoms include difficulty sleeping, lack of energy, shortness of breath, muscle or joint pain, swelling of the arms or legs, hallucinations, panic attacks, flashbacks, nightmares, loss of self-esteem, depression, or mood swings. Septic shock. Sepsis shock can cause respiratory failure, heart failure, kidney failure, or injury, and a normal blood clotting. The mortality rate for septic shock is about 30 to 40%. Peritonitis is a redness and swelling inflammation of the lining of your belly or abdomen. This lining is called the peritoneum. Peritoneum is often caused by infection from a hole in the bowel or a burst appendix. Symptoms of peritonitis include severe abdominal pain that worsens with movement, tenderness or swelling of the abdomen, fever and chills, nausea and vomiting, loss of appetite, thirst, reduced urine output, inability to pass gas or stool, bloating or feeling full in the abdomen, and upset stomach. Complications of this is sepsis, a life-threatening infection when the body's immune system overreacts to the infection, causing widespread inflammation. Sepsis can lead to organ failure, shock, and death. Dehydration, fluid buildup in the abdomen can lead to severe fluid loss and dehydration. Kidney problems, liver failure can cause kidney problems. Brain function loss: if the liver cannot remove the toxins from blood, brain function can be lost. Abdominal adhesion, scar tissue from inflammation can obstruct the bowels. Constipation and urine retention, organs may be temporarily paralyzed, leading to constipation and urine retention. Hepatoneal syndrome is in people with liver disease. Spontaneous bacterial peritonitis can trigger a hepatoneal syndrome. Tertiary peritonitis, an infection that returns after the original cause has been treated. Abnormal blood clotting, widespread infection can cause abnormal blood clotting, and acute respiratory distress syndrome, a severe lung infection. Gangrene is a serious condition that occurs when the body tissue dies due to a lack of blood supply. Symptoms are skin discoloration. The skin may appear red, purple, black, brown, bronze, blue, greenish, black. On darker skin, discoloration may be hard to see. Pain and numbness. The infected area may cause severe pain followed by numbness. Swelling, the area may swell. The affected area may have a foul-smelling discharge, pus, or sores that bleed. Other symptoms include the affected area may feel cold or cold to the touch, or have thin, shiny skin without hair. Other symptoms include blisters, crackling, feeling under the skin, or persistent fever. Complications of this include is a dangerous condition which can lead to serious complications if not treated. immediately. Some complications include bacteria from and gangrene can spread to other organs and tissues, leading to sepsis and septic shock, amputation. In some cases, a body part may need to be amputated to save the patient's life. Scarring, removing infected tissue can lead to scarring. Reconstructive surgery, the need for reconstructive surgery such as skin grafting may be required. Organ failure, symptoms, cases of gangrene can lead to organ failure and death. Gangrene can be fatal. Multi-organ failure is also known as MOF, is known as multi-organ failure dysfunction syndrome, is a serious medical emergency that occurs when two or more organ systems in a patient are failing to function properly. Symptoms of this include nausea, vomiting, loss of appetite, weakness or fatigue, fever, chills, confusion, difficulty breathing, quick, shallow breathing, fast, irregular heartbeat, low urine output, chest and abdominal pain, and loss of consciousness. Complications of this is respiratory distress syndrome, renal failure, liver failure, neurological dysfunction, coagulation, abnormalities, brain damage, and stroke-like symptoms, which can damage, Abdominal abscess. An abdominal abscess is a collection of pus in the affected area in the abdomen or belly that usually caused by a bacterial infection and can occur in or near the liver, pancreas, kidneys, or other organs. Symptoms of this is pain in the abdomen, upper back, shoulder, chest, fever, chills, nausea, vomiting, loss of appetite, and weight loss, swelling in the abdomen, change in bowel movements, rectal tenderness, or fullness, mass in the abdomen. The exact symptoms depend on the location of the abscess. For example, a sophrenic abscess may cause shoulder tip pain, hiccups, or halitosis if the abscess is deep in the pelvis, or whatever that is. There may not be no clinical signs. Risk factors for an abdominal abscess include abdominal surgery, trauma, diabetes, and inflammatory bowel disease. A healthcare provider can perform tests to help determine if you have an abdominal abscess, such as a complete blood count or a comprehensive metabolic panel, so a CMP and a CBC. Complications of this is sepsis, organ failure, bowel obstruction, fistula formation, multi-organ failure, death, deep vein thrombosis, which is a blood clot, malnutrition, which means you're not getting enough nutrients, emphysema, lung abscess, or pneumonia. Don't worry, and don't forget to share so others can see this video. Don't worry, guys, it's rarely fatal, as said before in the beginning of this very long video. Some of this does happen, but it is a very rare occurrence. Most of the time, you guys can get something shoved up your butt to relieve all of the poop and all of that. So yeah, I just want you guys to know, don't worry, this probably will never happen to you. I pray to God nothing of this happens to you, me, or anybody. Hope you guys have a great night, and remember to stay researching.